Presenting a case of male 86 who present to me with left-sided suprascapular swelling about 5 into 7 centimeters square in size. On USG, there is about 7 into 5 centimeters square thick walled abscess involving superficial subcutaneous plane in the lower part of the left side of the neck, and there are multiple infective nodes are also there. There is no sign of warmth, there is minimal erythema, and there is no pain. That finding suggestive of cold abscess. And on palpation, this abscess is fluctuant and soft in consistency. So it seemed to be a clear case of cold abscess on the left neck, most commonly due to tuberculosis. Tuberculous cervical lymphadenitis is the most common form of extrapulmonary tuberculosis and seen in endemic region in Asia like India. Mainly there is cold abscess formation by hematogenous route or lymphatic spread from the tonsil or upper GI tract TB into the lymph node. Most common node involvement is the second jugulodigestic node followed by third followed by fifth then one and fourth. This is the sequence of involvement of the node. There are four stages mainly. Lymphadenitis is the first stage, second is periadenitis, third is caseation, and fourth is cold abscess formation. These are the four stages of cold abscess. Sometimes there is fifth stage of sinus formation, that abscess itself drain outside the skin as a sinus, that called sinus formation. So main treatment of this the IND, incision and drainage followed by AKT therapy, that about 6 to 9 month therapy for this tubercular infection. So first investigation is USG, then FNAC, and you can do CRP or CBC for the follow-up cases. So main treatment is incision drainage and anti-tubercular therapy. Sometimes you require repeated aspiration of this pus, but best if this large abscess is there, you do incision and drainage. That ultimately you have to clear all the focal of infection in the neck. As this case present to me with about 100 cc collection in the left suprascapular region. First, I will aspirate this by the 10 cc multiple syringe with 18 number needle so that I can remove all the abscess. After that aspiration, I will do proper incision and drainage so that I can remove the all necrotic nodes as well as all necrotic tissue from the neck so that infection will be clear out from this site. After doing so, I will apply the betadine and hydrogen peroxide wash so that all bacterial or infection will be die by this solution. You can see this is amount of pus about 100 cc approximately as seen in the USG. After doing betadine and hydrogen peroxide wash from this incision site, I will do the streptomycin powder application and roller gauge betadine hydrogen peroxide pack so that I will do this dressing almost for 2 to 3 days after clearing the all pus, and I will do the AKT therapy in this case about 6 to 9 months.